The strategy involved in the surgery can vary from simple cases, we were talking about using endoscopes earlier, to simply remove the fused suture and perhaps make strategic cuts in the bone to allow the bones to grow better. It can involve using a molding helmet after surgery, but what we usually have to do is not simply remove the fused suture. We frequently have to reposition the bones that have been innocent bystanders, that have been forced to grow in an abnormal way, and put them in a better position so that immediately after the operation, things look the way they should look. So some of this involves making sure that what we reconstruct is going to be strong enough for that baby to go home and bump their head on the crib, because they always will, and yet not be so strong that it fuses too quickly again. We do want the skull to grow together to be strong, but we also want this strong skull to be able to continue to grow normally. So the way we do this is by using a combination of techniques. One technique involves holding bone together with dissolving suture material, same sutures that we might use in other surgery, and that can allow us to get things assembled in a very good shape, but it may not give us enough structural rigidity for the child to be safe in the immediate postoperative period. And in those cases, we'll also use some small plates and screws that in the old days were made only of titanium. And about 17 years ago, we started using these devices, but composed of dissolvable polymers. So no metal involved. We don't use stainless steel wires anymore. We don't use titanium anymore. And these little plates and screws will give that baby the strength that we want to hold the shape that we want and to provide that protection. And those babies typically don't need to wear helmets after surgery. Only a very small number of patients will need one of these helmets after surgery, and it's not as much for safety as it is for molding. But I think you can start to see that the techniques that we use are incredibly broad. And when I think back to how I started doing this, these were single techniques. It was like going out on a golf club with on a golf course with one golf club. But now things have gotten very elaborate, and we can see that the one technique that may be right for one baby may not be the best technique for the next baby. But it's how we can discuss this with parents and choose the best technique to give that baby the result that we want that's important.